Good morning. I want to thank our witnesses for being here today to discuss the crucial issues before us, collapse of the private practice and the impact it's having on patients as well. Americans across the country are hurt by skyrocketing inflation from the past 4 years. I'm a former business owner, and I know firsthand how inflation harms small businesses trying to benefit their communities. Physicians are no different. Nearly 90% of the medical groups reported increased operating costs last year. According to the Medical Group Management Association, physicians' costs increased by over 63% from 2013 to 2022, making it harder to run a business, let alone their own practice. During the same time frame, Medicare formula for calculating physician payments has increased by only 1.7%. In fact, the adjusted for inflation, the practice cost, Medicare physicians' pay rate plummeted 29% over the past 2 decades, with large changes year over year. So how can we get doctors afford to stay in private practice when their costs are skyrocketing, their reimbursement rates continue to get cut? Many times physicians are forced to sell their practice or consolidate and with a larger system stay afloat. Let me be clear, whether or not to sell a practice should be the choice of the physician based on what works best for them, their family, their practice, and their patients. They should not be forced into a practice consolidation. And I just tell you, myself as a business person for 30 years before I got here, I started, my wife and I, a small business. It was the American dream. We created 5,000 jobs from nothing as a couple of blue-collar kids. So a lot of times that leads to other opportunities. I'm not saying that's good or bad or indifferent, but that's just my story. But there's other stories like that. So when I hear people are getting crunched in terms of whether they can even stay in practice, I don't like hearing that, but we'll talk more about that today. Further, I'm concerned that our being transformed from entrepreneurs into employees. According to the American Medical Association, the AMA, between 2012 and 22, the share of physicians working in private practice fell by 13% compared to 3 decades ago, where there are now 30% fewer physicians in private practice. A thriving healthcare ecosystem should be included in a balance of large health systems and small local mom and pop practices. Back in the day, it was much easier and less expensive for young doctors coming out of medical school to start a practice in their hometown. Now, when I talk to young doctors coming out of medical school, many of them tell me it's too expensive of an endeavor, and they rather work for a larger system where they can collect a steady paycheck and not worry about the increasing administrative burdens associated with running a practice. Another issue I continue to hear from our docs is the growing rate of frivolous lawsuits against the medical community. AMA analysts show that in 2019, medical liability premiums increased by 27%, almost double the rate from 2018 between 2020 and roughly 2022, 30% of premiums increase year to year. I'm extremely worried about the pressure the trial bar is putting on physicians. At least in my state, I can talk about that. And then I hope that we can talk about what it costs defensive medicine. And many of the doctors that are surgeons, maybe if they're 60, they're leaving their practices early because they don't want to take the potential risk. With that, I look forward to the discussion today.